Welcome to episode 11. We have a special guest host today of the What Are We Thinking podcast. We have Mark Anderson with us. Pastor
hello.
Alex is on vacay.
Yeah, beaching it.
In the Keys. He's not in the Keys. He's at Panama City Beach.
PCB.
PCB. I think that's a good initial because it sounds kind of dirty, like PCB. So I think
Like
that's
PCP?
good. Yeah.
But it's PZ. Not PZ.
Busy bee.
Yeah.
Busy bee.
Panama
So,
City.
welcome to episode 11. We hope you guys have enjoyed this podcast. We are in the double digits now. We're really excited, really stoked. We got some really cool things coming up in the future of this podcast. We're going to have two really great guests today. But I want to go over and ask Mark a really quick question. Mark, how has your week been?
It's been fantastic. It was really great today. I got to listen to a podcast first thing this morning.
Of yourself?
Of myself, yes. So if you could, like, subscribe,
Yes,
share. Love this podcast. I look forward to this every Friday.
Yes.
Not as much this Friday because I was on it. I knew kind of the content, and it wasn't anything educational.
Right.
But over the last 9, before that, were phenomenal. So
Awesome.
I appreciate you having me on here. But how was your week, man?
It was really good. It's been really weird. Pastor's not been here all week. My week's been really good. I'll tell you what, I've actually talked to some people this week. Coming back to church has been kind of weird.
Yep.
Because not everybody's here. The people are here. It's just everybody's in a weird place right now. So we've been talking about that all week. How we can. I think Pastor's done a really good job of lightening that up, where we've had a lot of lighter things at church, where it's been a little bit more fun, a little bit more
Fun month.
that was needed.
Yes.
To lighten everything up right now because things are so heavy on the outside.
Yes.
But I've had a good week. I'm trying to think all the things I've done this week. I have a lot of things coming up this weekend. My youngest son graduates preschool tomorrow. My mom's birthday is tomorrow. My daughter's birthday is Sunday. So,
Wow.
lots of celebrating this weekend.
Yeah.
We're actually going to do all three at one time. We're all going to go to Jackson together and wear masks.
And everybody
I'm so
wear a
excited.
mask.
Yes, I'm
Yes.
so pumped. So it's part of our headline segment today. I can't wait to even talk about it.
How does that work? Oh, we're going to talk about it later, right?
We are, but the one in Jackson's no big deal. I don't have any problems. Every store I went in, I wore a mask, got what I needed, left, no big deal.
How do you eat with a mask? Like if you're going to go out to eat.
You don't have to wear one at a restaurant.
Okay. All right.
Well, you do when you come in. When you're at your table, though, the virus will not penetrate the walls that are surrounding you. I don't know, man. It is weird, but I had to do that in an airplane because we flew a couple weeks ago, and I had the mask on. But she brought me the little snacks.
Yeah.
Yeah,
I
I love snacks.
Oh yeah.
So my Southwest little snack bag, and I got it, and I was like,
pretzels kill the virus.
I pulled the mask down so I could eat.
Yeah.
And then I lifted it back up. And I was almost ashamed that I pulled it down. I was like, I'm so sorry, guys. I don't want to spread
Well,
this.
you can't treat it like a feed bag on a horse. You can't just shove pretzels in there and just try to maneuver them around to eat them.
Right,
You can't do that.
Right.
So, yeah, I would have done the same thing. But
So anyway, that was it's been my week so far, getting ready for those things happening.
Awesome.
And let's dive into some headlines today.
Ooh, let's do it. I'm excited.
Oh, I'm so excited for some headlines today. The first one is Pentagon effectively bans Confederate flags on all military property.
Wow.
Yes.
Yeah, that's a hot topic.
It actually doesn't even name the flag in the policy.
Wow.
Yep.
What's your thoughts on that?
I'm being really honest about this flag. Everything that I've ever seen from the civil rights movement up until now, I have never seen that flag in a good light.
Agreed.
Never seen it portrayed in a good way.
Mm-hmm.
When somebody's flying it, it's intentional, and I think we all know the intentions of it.
Yes.
Now, we can pretend that we all care about Shiloh, I guess, as much as we want to, but and we can all say this is all a heritage thing.
Yeah.
And we can say that we should want to not bring that into someone's face, though. over and over and over because everybody knows what it means. Like, I think Keith said it best when we had the conversation at church. That got hijacked. And whatever it did mean, it doesn't mean anymore. And people use that as a symbol of hate all the time. It's like, I'm sure the swastika from the Nazis may have a nice meaning to it.
For them.
But
for that group of people.
Anybody else.
Yeah.
If I ever see it, I don't go, oh, they're celebrating their heritage. I just don't do that.
I've just always felt that we're supposed to be one nation under God. And one flag is supposed to represent us as Americans. And so when you're honoring multiple flags, regardless of heritage, the one flag that we have now is the one with red, white, and blue, 50 stars. That one. That's the one, the American flag. Yeah. And that's the one that we hold dearest. And, we don't want it trampled on or burned or left on the ground. But a Confederate flag, this will be a hot topic issue for some, whether that's a battle flag. And I've also seen things where they say this is not the original battle flag. This was this was some sort of rebellion flag, and that's the reason it's called the rebel flag and Confederate flag. And I think honestly, if you hold that flag dear, you can still continue to, but I don't think it should be honored in places where the American flag should be present. So that's just my view on it. I think we agree on that. But
headline number 2. So Yosemite National Park was a very safe place. I'm going to pause real quick. Bring your mic up a little bit closer to you just so we can get you. Yosemite National Park is supposed to be a very, very safe place. Well, they tested the park's sewage. I want to read this part of the article. It's really funny. Let's see. It was so funny when I read it. It said that that's right. They considered it a safe haven until local health officials started looking for the coronavirus in the park's raw sewage. That's right, the poop. They tested the poop and the feces, and it was they found the virus that causes COVID-19 all in the poop. So now they're telling everybody, hey, dozens of you could be infected. Yeah, so I don't even know why they tested it. I have no idea. It was just a random thing to do.
Well, then collecting fecal matter would be easier than shoving that cotton swab to my brain.
Oh, no doubt.
If we're doing testing and I have to be tested, I'm bringing my own samples in. Got it?
Oh, no doubt. So, that's good. That's good.
Do I have the virus, Doc?
Well, I mean,
was it bat guano they were checking, or was it?
I don't even know whose poop it was. Was it all human? Was it animal? Who's got? I don't know. That's weird. That's very weird. They didn't really elaborate on that. I thought that was kind of funny though.
We need details.
So you're a man that loves to cook. You're a great cook.
I do.
You are a great cook.
Thank you.
You are.
I enjoy it. Yes.
Yes, you are, and you have a grill that was built by NASA. There's been to space with SpaceX. So
Elon Musk.
I can definitely appreciate your input on this. Should you wash your mushrooms that you're going to cook?
We have now 2 headlines that pertain to poo. So, mushrooms. I'm not a huge mushroom fan. My wife cannot stand them. But I've had them. I have cooked with them. And my opinion is, yes, you need to wash those because what they come out of, it's a fungi. It's a fungi.
I have no idea.
It is. So, yeah, I would say you definitely want to wash them because, you can go get them on any cow patty in a pasture.
Yes.
They grow on those. So, yeah, I would say, that's a good call on washing those.
I wouldn't even know. I don't think I have every time that I've cooked those. But I'm not like one of those, I don't wash anything before I cook it. I just cook stuff.
Cook it at a high enough temp, it kills it all.
Yeah, that's how I see it. It's going to go on the grill. It's really hot over there. So it's going to it's in that or the skillet. So I don't really think anything survives those
Either
things.
way.
But it does say this. It says some varieties requiring longer and more extensive scrubbing than others.
I don't scrub anything.
Right. That's what I was thinking.
Run some water over it.
What kind of brush do you have to buy that can scrub a mushroom? Without completely destroying it?
My wife's toothbrush. She hates mushrooms. She's like, oh my gosh, this tastes like mushrooms.
I don't even know if a toothbrush would work. I feel like it would just like start tearing it all to pieces.
I mean, it's a mushroom. It's pretty
scrubbing.
fragile.
Scrubbing is kind of a weird word. Maybe say like, put more pressure with your fingers. I don't know. Like scrubbing is such a bad.
Mushroom people, please reach out to us. I think
please email us.
We've got a few friends that like they're diehard mushroom folks, and they love them. Morels, morels, those kind of. I'm not in the mushroom game, so I don't know. But yeah, reach out, let us know your thoughts on. Do you throw those in the washing machine? What do you do with those?
And it says make sure they're fully dry. Like, what does that even mean?
They're already a weird texture. Like that's what I can't get over. The flavor is great. It's the texture.
Yeah, they're
so weird.
Mm-hmm. Yeah, I agree.
It's
kind of like eating what are those things? Just the
snot,
mussels.
Oh, oysters.
Yeah.
Yeah. Oh. Yeah. I don't eat oysters either.
I did that one time, and they were like actually cooked.
Yeah.
I would never eat them raw. Like
I've had deep fried oysters. That's the only way to eat them.
So I had them cooked, but like. It was like a little, like just.
Yeah.
I suffered through it. We were on vacation last year, and my wife's like, "So what do you think?" And I was like, "I think they're terrible." And so just eating them was just, it had a really weird texture, and I just couldn't handle it.
It is a textural thing. It's not. Yeah, it's not good.
No doubt. So let's hit the Stop It segment for today. Stop it. I'm excited, Mark. You brought a Stop It segment today, and this is going to be so much fun.
I've got a few that I've been kind of holding back. Like ever since these podcasts have started, I see things and I'm like, ooh, stop it. This one, I'm not going to call out the family member that did this, but it was one of mine, so I can claim them. But stop sharing posts about, if you love Jesus, share this post. That does not determine your love for Jesus. But the picture was Obi-Wan Kenobi. It was Ewan McGregor from a Star Wars movie was the picture. So, again, let me reiterate this because I kind of jumped around a little bit. Do not share a post about how much you love Jesus and it be a picture of Obi-Wan Kenobi from the Star Wars prequels, okay?
I'm going to even take that a little further. Stop copying and pasting. Golly, Bill, man. Like every post I see is like 4 people posted the same post, and it was like, create your own content.
Yeah.
Like, have your own idea. Like, if you don't like this, just don't like it and say it. You know what I mean? I know this other post says it better than you can, but like, just say something different.
I'm cleaning up my friends list, and if you don't like and share this, we're no longer friends.
God, yeah, those are so bad.
We're still going to be friends after this.
Oh, those are so bad.
Or maybe we're not. Maybe it works both ways.
I want to see who's reading my post. No, you don't. Like,
no, like, I don't. That's great.
Oh God, those are so annoying. I agree, man. Those drive me nuts. And, I would even tell people, like we tell our kids to don't watch a lot of cartoons.
Yeah.
How about adults stop watching so much news?
Ooh, that's a good one.
I think maybe too much news is bad for your health.
My wife will vouch. When I go to the gym early in the morning. When I come home, she's got the news on. She watches the local news, and then national news comes on after that. And whenever it comes on, I am normally turning it off.
Yeah.
Like it's just I don't want to start my day. I want to start my day with some positivity. Not saying that all news is negative, but man,
most news is negative.
It's a lot of negativity.
Welcome to the local news where your day is gonna suck. So thank you for that. Thank you for telling me my day's going to suck and everybody around me is a jerk. Like, I didn't already know that. I have Facebook. So I already knew that everybody was a jerk.
Let me share this.
Oh, man, this is so good. So thank you for the Stop It segment, Mr. Anderson.
Oh, you're welcome. You're welcome.
One of our guests is on right now is Dr. Aaron Davidson. I love saying that. I'm so proud of you. I am just so proud of you. And I love saying Dr. Aaron Davidson. Like, it just brings my heart a lot of joy to say Dr. Aaron Davidson. And I want to say thank you so much for what you do, the line of work you do.
Yes.
I know it's crazy. I know it's insane. I know you work a lot of hours. You're on call all the time. You're helping people that are sick. Like I want to say thank you for risking all that you do for everyone around you. That means a lot to me personally because I know people that have been affected by all the things happening right now, and people like you helping taking care of those people is amazing, and we appreciate what you do, Dr. Davidson. So thank you, sir, so much for what you do.
I appreciate that.
So,
are y'all able to hear me? I didn't actually check.
Yeah, we got you, dude. We got you. You are loud and clear. I will actually get you set up there. Now, Dr. Davidson's mother should be on with us at some point. Miss Karen
When I hear Dr. Davidson, that's who I look for, is my mother. Hearing Dr. Davidson in reference to me is still strange.
I bet, dude. But you know what? You did it, man. And that's such a cool honor, and I'm proud of you. And I have some questions I actually sent to you last night, and we'll talk to. We'll hit your mom up on some of these too. Everybody has a feeling about this virus and this pandemic and everything going on around us. Everybody has. We all know there's agendas being pushed. There's always going to be that. That's just the climate we live in. Whether it's media, government, whatever. Everybody's got a thing. I want to know, from a medical perspective, and where you stand on where we are with COVID-19, especially it doesn't have to be a national perspective. It could be a perspective from where you're at, where you sit, in the hospitals that you work in. So, what is your opinion on it right now?
So, obviously, COVID is here to stay. It's not going anywhere.
Right.
In some places, it's a bigger deal than others. For example, there's no mandated mask wearing in Weakley County, at least that I know of, and some of the other surrounding counties like there is here in Madison County. Obviously, I work at Jackson General, where essentially anyone that doesn't go to Memphis or Nashville, they show up here, especially if they're sick with COVID. So, at least from my perspective, I get to see the sickest of the sick, and I also get to see a whole bunch of folks who do quite well with it.
Right.
My take on it, at least at this point, is it's not going anywhere. And so it's something that we'll talk, I'm sure, later about this, kind of how we deal with it moving forward. But it's something that it is indeed a virus. But the good news is that the vast majority of the population does quite well. The reason a lot of the numbers are going up and lots of positive cases are showing up is because more people are being tested. And a lot of those are either tested from work mandates or people going back to school, or they've been exposed, that kind of stuff. But again, to emphasize, the vast majority of folks do very well with this. And so I want to paint a picture of seriousness, and that this virus can be quite serious and can cause quite ill effect to some people, but that is only in a very minority group of folks. And so that's kind of how my family and I have approached it, is we take the steps we can to kind of limit our exposure or limit our risk, but also understanding that it is a virus, it's not going anywhere, and it's something that we're just going to have to figure out what the best steps moving forward are as far as day-to-day life. Are we going to be wearing masks forever? I don't know. Are we going to be socially distancing forever? I don't know. So essentially my take on it right now is accept it for what it is. It's a virus. The vast majority of people do well with it. Some people don't. So I think at least my take is protect those who aren't going to do well. And I think that's what everybody's working through right now. It's how do we best protect those who are most at risk. So
that's really, really good. And now your mother, Dr. Karen Davidson, has joined us as well. We love Miss Karen. She's amazing. I just asked Aaron, kind of
Davidson Senior.
Yeah, Davidson Senior. So we have there's so many doctors in your family. Your whole family's brilliant. You all have great genes. You're all skinny. You never gain. You're all just perfect health. You guys blow my mind.
That's not
Aaron,
true.
yeah, it is true. Because you make fun of me for running. And if I didn't run, I'd just be fat. So I have to run because otherwise the food that I eat will catch up to me and I will be unhealthy. And also, Karen is my dad's primary doctor, and that is a load in and of itself to take care of a person that refuses to do anything the doctor says. So
your dad does that too. Oh, okay.
All dads do that. All men of that age do not listen to doctors at all. So that is definitely something that she has to deal with. Now, I did talk to Dr. Aaron about no matter what people feel, no matter what everybody. There's lots of feelings about this thing. Like, there's agendas and feelings and all kinds of other things. And I just kind of asked him, like, what, from a medical perspective, like, what is his opinion on COVID-19 and kind of like where he was with it. That was what he was answering when you got on, because we have to take the feelings out of it. Like, at this point, like, we got to get rid of that because everybody has a feeling. Mm-hmm. And I'm so tired of hearing those feelings every day on Facebook. But other than that, like, from just being a doctor and what you've seen, like, what is your opinion on it? Just as a whole, like, right now, future, that's kind of what he was referring to earlier.
I was smiling when he was talking because it sounds almost like wishy-washy. You got to be careful, but, and, back and forth. And that's one of the things with this COVID thing is, like you say, everybody's got an opinion, and is it real? And unfortunately, I came in on the tail end of what he was saying, but it is real, and it can be really serious for some. One of the things we were talking about before now, so we wouldn't argue about different opinions when we got on here.
So good. Way to prep.
And surprisingly, we were both on the same page about everything. But that's one of the frustrating things about this is that in medicine, at least until this, everything was, this is scientifically what we know, what we don't know. And all this junk was not part of it. And this is a whole new thing for us from a medical standpoint, just because of politics being involved and things that, at least during my entire medical career, such that it has since the 80s has not been the case. So that it makes it hard for even us to get objective information now, because it's getting filtered. But objectively, it can be really serious. This thing about masks and are we going to wear masks forever and stuff? Well, hopefully, depending on whether we have either a pill like Tamiflu does for the flu, or something to make it less severe if you do get it, or a vaccine, we're at least going to be dealing with this through the rest of the year.
Right.
And but hopefully, once our bodies get some immunity, then we'll be able to get closer to our regular lives again. The other is the mask, no mask thing. Did you address that, Aaron?
I think he hadn't got to that question yet, but
it's coming. It's definitely coming.
All right.
So, okay.
I will jump the gun.
Because I know, like, different scenarios for different people. Like, our youth pastor had it. He was the first case in McKenzie. And when he got it, it was like he had leprosy. I mean, it was like we had to issue a statement from our church. Like, people were freaking out. Of course, you know how, like, the Southern people are with social media. And it was like, we're hiding information. It's a cover-up. There's
conspiracy theories started flying.
We were being brainwashed by the liberal media. All those crazy things you hear. Now, and he did okay with it. He was barely sick. It was a couple of weeks. He had a fever. He had some symptoms. Now, my wife, her boss, he's actually a doctor, and he went from being a doctor to being in this company. He's had 5 people that he knows die from this thing. Now, 2 of them had pre-existing conditions, but those conditions they were still able to live with until they got this. Now, this is in Louisiana. These are in these parishes, in different places. So I've heard so many different, scenarios and outcomes and things like that. When it comes to being proactive instead of being reactive is because I've been to Jackson. I've wore my mask. Like, I don't freak out about it. It's not a big deal to me. Like,
I just ordered one.
I don't get upset about it. They're not taking away my guns and all the rest of my rights. Like, I'm not in that crowd, so I don't even get that. But my question on that was, should we should we not wear masks? Like, what is this? What is a logical like answer for that? For everyday people that are going to listen to this and like have like, because we need to like develop some like common sense too about this stuff instead of like, you know, being upset that we have to change our lives for someone else. And I think that's the biggest thing, because we have people in our church who are really, really afraid. We have people in our church that are really, really angry that we've taken precautions here and there or not had church. But should we or should we not? Like, what's the safe protocol for that?
So I'll take a stab first, and let Davidson Sr. see what she has to say. But essentially, my take on the mask, and again, this is not me as a physician, this is just me and the way that my wife and child and immediate family have kind of discussed the whole mask issue. Around my immediate family, I know who's at risk, who's not, who's been exposed, or, you know, theoretically the risk there. So, like, we don't, you know, in the presence of each other, or even immediate family, like, we still have family get-togethers and hanging out, and even with my fellow employees here at work, like, we don't wear masks around each other, mainly because we know each other's risk and our exposure. I think where the problem comes in is you don't know everyone's medical history or their theoretical risk to their response to this virus. And that's the biggest issue, is that there are so many people, basically everyone that is on this podcast right now hosting it would probably do just fine, just based off medical history and age and health status and all that kind of stuff. May have some mild symptoms, whatever. And in that case, it's inconvenient, but inconvenience at best. And so the part that I struggle with is wearing a mask isn't that inconvenient in the grand scheme of things. It's obnoxious sometimes because you have to pull it down to breathe, and it gets hard to breathe. It's itchy, face is hot, you can have sinus issues with it. I understand all those things. But, you know, at the same time, you know, one of my colleagues pointed out, if I can be inconvenienced for, you know, a few months or even a year, worst case scenario, we're doing this for a year, if it saves one person's life, I mean, that's what, as a physician, myself and some others got involved in medicine for, is if we do all this work just to save one life, it was worth it.
Yeah,
and that's a really hard thing to comprehend, because a year is a long time to do something you're not super comfortable with, or that you don't agree with. But, you know, again, I think it's just one of those things right now, especially in public, if you're going to be in a really tight area like a restaurant or something like that, or standing in line somewhere, I think it's reasonable to wear a mask. But again, when you go out to eat, you can't wear a mask and eat at the same time. No. And so there's some practical application there. Like, if you know you're going to be standing in line and you're shoulder to shoulder with somebody, wear a mask. Try to be as socially distant from somebody as you can. Or if you're going to go, you know, ride a bus or be in a plane, all those kind of things, it's reasonable to wear a mask.
Right.
But if you're in an intimate group of friends and, you know, everybody understands each other's risk and all that kind of stuff, fine. My biggest take on the whole mask issue is just everybody make their own decision independently. I don't think that we should be mandated to wear masks, either from the healthcare field or even from the federal government or anything, local governments, that kind of stuff. I think that if each one of you would just consider what the point in wearing a mask is it to protect yourself or to protect others? And ultimately, if you're not protecting yourself, take on the responsibility of protecting those who can't protect themselves.
There you go.
Because some people, even though they have the mask, they're susceptible enough that even the mask isn't going to help them that much. And so the best thing for you to do to help that person is to limit your exposure to them. And the best way you can do that besides social distancing is wearing a mask. And so, yes, it's obnoxious, and I have to wear that thing all day long. And when I actually see patients in the hospital, I wear that mask and a shield and goggles and sometimes a full suit and gown. And so, like, I get it. Like, the mask is not cool to wear all day long, but it's a very small inconvenience at this point with a potentially high reward, if that makes any sense.
Yes.
Yeah, that's good.
One of the things that really grieves me about the mask situation is that they've made it wear a mask to protect others. So when someone comes into a store, you've probably all seen some video where someone's come into a store and they don't have a mask on, but everyone else does, and everyone all but shuns them. It's like ducks on a June bug, to do the Southern saying, that they all but attack them because they don't have a mask, because they perceive that person is putting us at risk. And really, it's the opposite situation. the the whole mask thing, Aaron and I have debated it back and forth since the beginning. And the truth is, the mask isn't going to protect you 100%, obviously. But the mask, the main thing, as up to date, at least Wednesday, because of course the data keeps changing. But the thing with, as I tell patients, if you get you see these people who aren't even that sick, and it's there. So if you get just a little bit of virus, then your immune system has a chance to learn it because it's never seen anything like this before. It gets to learn that, and then you respond and build your immune response, and then you're okay. Whereas if you get excuse me, a huge viral load, then you're one of those that end up in the ICU. The mask helps reduce how much you're exposed.
That's good.
And so the big deal is viral droplets, what you get from coughing, sneezing, that type thing. The good news is it does not seem to be hanging in the air. At first they weren't sure whether, some cloud could hang there at Walmart and then you walk by in a few minutes and catch it. There are actually some things that do that, but it turns out that's not the case, except in the hospital situation where we're instrumenting and aerosolizing, doing those breathing treatments. And so unless you're in a hospital situation where we've got to do all this stuff that Aaron said, you're wearing the whole garb, you don't have to worry about at least that aspect. So you're wearing the mask, one, to, if you get exposed, you just got a bad cold and a bad week versus a 3-week ICU stage. Or, if you're one of those people you smother, and you know what the risk is, I don't think the rest of us should beat you to death just because you don't have on your mask.
Right. Yeah. Yeah. And I've seen that on both sides. Oh my goodness. Like, we have such an emotional, there are people that get really mad at people for not wearing a mask, and there are people that get really mad at people for being asked to wear a mask.
Yes.
Somebody at North Jackson Walmart an employee got attacked yesterday because they asked somebody to wear a mask.
Wow.
And I'll be honest, like, I don't want to force anybody to do anything, but I think what Aaron said is really important, and what you're saying, have respect for other people, like, and I think that's the problem, especially where we live. Like, where we live, we really struggle with that. Like, the South is like, nope, I ain't gonna do it, Like, that's that mindset of where we live, and so they even have that voice. I ain't doing it. It made me not wear a mask. So, like, that's kind of like that thing you get here, but loving your neighbor enough to say, hey, like, I don't know your medical history. Like, I think that's a good idea, man. I think that does speak volumes. And I even, like, one of my questions was, so how should we be doing this at church? Like, obviously we meet physically now. It's not as many people. That's been a really, we've had to manage expectations there, I guess, but it's been different, and it's been just a whole new, thing to do as far as, like, doing church now. With people here, it's not as many. They're a little more spaced out. It's a little awkward at times, but, like, should churches be? Because, like, that's the thing. Churches aren't required to do anything, even from the governor. It's like, other places may, even in Jackson, you don't have to wear a mask at church. I'm pretty sure.
That's awesome, isn't it?
So, but is that, like, should we, like, at least tell people to try, or it's like, what should we do with that? Like, because you're in the same boat, you're probably going to be standing around the same people. Like, I know we need to make it where we're not as close, but is that possible? I don't know. I don't know what to do with that, because I get from both sides. I get people that don't want to wear them, then I get people that say we need to be. So you guys being doctors, like, what should we do with that?
Personally, again, my take on this thing is that we're not mandating or keeping folks away from each other on Monday through Saturday. So
right.
why should Sunday be that much different?
Right. Yeah, that's true.
The people that I'm working with daily, I'm next to them all the time. And the same is true of just about anybody that's in work. You're working in close proximity to folks. And so I don't think that foregoing social gathering or public gathering of church is the answer. I do think that, at least limiting exposure at church, like some churches are largely an elderly population. Like maybe they should be more strict about their encounter or their proximity or that kind of stuff, just because they're ultimately at high risk. Some churches are primarily young folks, kids, teenagers, middle-aged. The risk there is very low. Okay. Even in severe illness, it would still be low there. And so I think a lot of that is dependent on the church itself. If you have a broad spectrum of elderly and young, I think it's wise to somehow distance them from each other for this time being. If there's an additional room that, folks could be in, like, I don't really know what the great answer for that is, but at least in a congregational type setting where you got a group of people in a big room and, listening to a pastor or something like that, if you have the space or the ability to create adequate social distancing based off all the guidelines that are out there, then I think it's perfectly reasonable to continue doing church that way. But, if you're in a situation where, like, you truly can't create that space or that social distancing, then I think that wearing a mask, washing the hands, that is still the most effective method, is washing your hands. I mean, you can wear the mask and you can socially distance, but if you're not washing your hands, then that's essentially where the droplet precaution comes from. Gotcha. So if anything, at a bare minimum, I would just encourage hand washing and, limit physical contact between people. Does that make sense?
Yes, yeah. Absolutely.
So. And that's what it started with, correct? Like it wasn't, and then it morphed into the mask and.
Yeah, so I think we started with washing hands. Of course, it was like clean every surface. That was a big thing for a while.
Which I have a 5-year-old, so that's, there's no telling what all she's touching. So.
And again, that's where the whole hand washing comes from, is you can't realistically, anybody who's had any experience with microbiology or any kind of infectious stuff in school, that it's physically impossible to have everything clean to a point where you're not going to get some kind of bacteria or virus from it. And that's where the whole hand washing thing comes from. You can submerge your hands in all kinds of infectious material, but if you clean them, then it really doesn't matter, because God gave us this thing called skin that works great for protecting us from things like viruses and all that kind of stuff.
Wow, so, good point.
And emphasizing the hand washing as being a big deal. So,
wow. So, and I feel like I had this like a few months ago, like first of the year. I was diagnosed with the flu, but I have never had something attack my lungs. Like whatever I had, it really I was so short of breath, like on a whole nother level. And I feel like I have really good breathing. I'm an avid runner. Like I work out every day, and I, for the life of me, could not catch my breath at times. Like it was just like, I don't know. It was a really, really, really strange thing. And
I had a business partner that said the same thing. It feels like he had it.
Yeah, it was a little creepy to me, like the fact that I just could not catch my breath at times. And it was really, and I've had the flu before, but never, I know flu's respiratory as well, but I've never had anything just go after my breathing like that. That was really, really intense. But, and I actually watched a thing from Andy Stanley yesterday where two people in his church had it, and they were going over and talking about like their experience. They took like one of the whatever that first drug was that came out, the
hydroxychloroquine.
Yeah, that's a word I cannot say. So that was, yeah. So, and he actually had a heart attack. He took the drug. He was up for 72 hours straight. Couldn't get his heart to slow down. He had a heart attack. They had to do a stent. He almost died. It was actually a really crazy story. But what does the future, like, I know we run into viruses all the time, and I know this has been the first one that's shut our country down or, been as severe as we've seen this. Does this change the future of what this looks like? Like, are you hearing, like, is there like how long does it take to get a hold of this? How long? I know you said it could be a year, but like, does this change the future? Like, medicine wise, like how does this look in the future as far as COVID-19?
Before we jump on that, a couple of comments about the mask. First of all, I am really thankful you said that churches aren't required or mandated. I'm thankful that at least in Tennessee, because other states are having to fight ridiculous
Yeah, I agree.
Yeah.
limitations. So I'm really thankful for that, and hope people take that into consideration as we get into the elections and the people who make those kind of decisions. Um, the other, just to emphasize what Aaron said, is wearing that mask in the groups. And you notice he kept saying washing hands. He didn't say hand sanitizer. The hand sanitizer is a good if you don't have water and can wash your hands, but the gold standard is still washing hands. And it's in our profession, you get really cognizant of everything you touch and do, but at least I do, between washing my hands and not, chewing on my fingernails and all that sort of stuff that lay people may not, but that's something we're going to have to get more cognizant of, is what you do with your hands. Mm-hmm. And I think the churches, at least the ones around here, seem to be really wise about limiting passing the plate and that type of thing.
Yes,
where
absolutely.
people can contact. The good news is, so a couple of days ago, I was really researching the whole go back to school deal. So people were asking me, should I homeschool or should the cleaning? It doesn't. You need to clean, but you don't have to do that super wipe down that at one time we were concerned about.
Right.
So that's the good news. Is I've got people who strip their clothes before they go in their house, and a lot of that's not necessary.
Yeah, my wife made me do that when I worked at Serval. Yeah, it's like, you're not bringing bugs in here.
No bed bugs, no fleas, no none of that stuff.
Oh man, yeah. So like, and that's great. I think, I'm so terrible about that. Like, I'm just not. I don't wash my hands all the time. Like, it is not a. But I don't work in your profession, and I'm just dirty, I guess. I don't know. I don't wash my hands a lot, and that's not a. I'm not proud of that. I just don't. And that's something I need to be more cognizant of. Just,
it's being more intentional.
It's interesting that if there's some videos actually you can watch of experiments they've done with like glow in the dark stuff they'll spray on kids' hands.
Mm-hmm.
And when you actually sit and think about every doorknob you touched, every time you touch your cell phone, your steering wheel, anytime you shake hands with somebody, or every time you push that door to open, like all of those things, those are all contact, and you are touching whoever else also touched that spot. Everybody leaves their mark on something they touched.
Wow. Yeah,
so
that's
when you
true.
Kind of put that in perspective, think about the buggies at Walmart. Like, if you could just swab one of those things and see what culture's off the handle.
And the people that go to Walmart.
Correct.
Like, that is, that's.
They'll wear a mask, but not real clothes.
Oh, man, that's so funny.
I digress.
That's so funny.
I can only speak for personal experience.
So, and the last question was just like, what does the future look like for us in medicine? Like, with COVID-19, what does it look like for you guys? What do you think?
I think ultimately, for me, it's going to depend on how we figure out immunity is conferred. Because a lot of these, you think about all the historical viruses we've had. Some viruses, it's a lifelong deal. For example, polio. People who got polio, they deal with that forever. Mm-hmm. Chicken pox, again, something that you can have reoccurrence of in your 60s with the zoster and all that kind of stuff. Shingles, those kind of things. So, is this going to be one of those? I don't think we actually know that, and can't reliably. Anybody that says they can is guessing at this point. Nobody knows. And I think that's the biggest question. That's the reason they're trying to limit exposure. But, again, me personally speaking, the virus is here. Everyone at some point in the next year, 2 years, is going to come into contact with it. Mm-hmm. It will make its way through the entire population one way or another. And I think that's what's terrifying the healthcare community at this point, is trying to figure out, like, what is this going to look like? Are there any long-term effects? Because there are some circumstantial things right now that people have some lung damage, but technically the lung damage that it's caused is from a condition that results from the virus. Respiratory distress, acute respiratory distress, ARDS. It's a lung injury. You can get that from vaping. You can get it from a whole bunch of stuff, but it's the same deal, an inflammatory issue with the lungs. And they've seen that some with COVID. And so they're like, is this going to be one of those things where you get COVID and then years from now you deal with it? I don't know. Personally, if we can get more data on this, the whole antibody testing that's coming out, for example, several of my colleagues were exposed to COVID, 5 and 6 times a week almost. sometimes 5 times in a day, depending on how many patients have it that you see. And so the question is, are those who've been exposed, are they developing antibodies? Or are those antibodies creating some kind of immunity in the future? I mean, the whole deal with the flu is you get the flu and you would theoretically be immune to the flu. The problem is virus changes every year.
Right.
So those are questions that only time will tell. I do think that once we get through this current wave in the United States of it just slowly making its way through the population, like for example in Jackson, we're just now seeing the quote spike that everybody was talking about. And it's not so much a spike just in Madison County, it's just a spike in our healthcare system because Jackson accepts so many patients from everywhere else.
Right.
Service population is 500,000 people or greater. And so when you got Memphis and all those other people that are packed, we get a spike of stuff here. But when you actually look at the numbers, like there are more and more people that test positive, but mortality rate hasn't changed, meaning that essentially everyone is still doing fine. And as long as that stands true, I think that we wait this out and we kind of see how it affects the general population. Once it makes its way all the way through, I think we'll have a better idea of what the future looks like with this, if that makes any sense.
Yeah.
Because we don't have any people yet who've been like, oh, I got COVID back when this all started, and then they got it again. Does that make sense? That's one of the good things, at least in the research and the paperwork that I've seen. We don't see any reinfection of COVID at this point.
Right.
And so maybe once it sweeps across, like maybe it'll be done. We don't actually know that yet. So
that's good.
Does that answer your question?
Yeah, absolutely.
And this, as Aaron pointed out, there's the future stuff that obviously we can't predict what will happen. And not to scare people, but with children, the question is whether some of the children that do get it, if they're going to have long-term inflammatory issues. So that is back to protecting, hopefully not getting a severe infection the first time around. But God gave us a wonderful immune system and the ability to heal and protect ourselves. And if our immune system the problem is this was bats. It was not intended for us as humans, and that's what is the issue. And we've not ever been exposed to it. But once our immune system gets it, the next question is how much is it going to mutate? And as he said, whether our immunity. But at least I feel if we can just get through this first wave, if you get sick, if it's hopefully minor, and if we can build our immunity, then hopefully next year won't be like this. And again, God is an awesome God, and we need to be talking with him and asking for his protection. And he has blessed America and us, and he can do that with this as well.
Yeah, that's good. And that's the thing. I don't think anybody, I heard this the other day, and it was in that same message with the couple that had COVID. One of our idols, I think, in America is certainty. And when we feel like we have lost some sort of control, we freak out. And we don't really have any control. We just think we do most of the time. But certainty is something that we hold dear, even though I don't really feel like that exists. But we do hold on to that word, though, because we think we know what every day is going to bring and every day is going to be normal. And now everybody's in this unknown state, and they just feel like they don't know what to do. And like when it's a health matter, it puts a lot of pressure. And there's a lot of pressure, I'm sure, on you guys as well, just because when you're seeing people, they're scared, they're afraid, there's all this fear built up inside of them, and then they're reacting. And then I'm sure you get that, on the flip side. But I do want to say this again. I told Aaron, thank you, and I'll tell you the same. Just thank you guys for risking your lives to treat other people, to do what you do. And it means a lot to me. I'm always thankful for doctors because it's the only reason I'm alive, like that and God. But so I'm very appreciative of what you guys do and just how you've, what you deal with daily. And this has put a highlight on that, I think, for everybody to know what doctors have to go through. And I know there's a lot of opinions on because this is a ever-evolving, ever-changing situation. Data changes, something new pops up, with a virus. It's just there's no just true data. Like it can change and evolve over time. But just thank you for what you do. And it's cool because we are actually talking to Dr. Aaron before he does a vasectomy. And I know that's in his plan today. And I will say this. I hope it goes great. My wife wants me to have one of those done. And
Come see me sometime.
well, I don't know if I want you to do it. I mean, like, we're friends, but I don't know, like, if I want you to know that part of me in that way.
Yeah.
I think I would be, like, every time I would see you, I'm like, I know what he's thinking about right now. Like,
Yeah.
I would be like,
Some colleagues I can refer you to.
yeah. So
it needs
I
to
do definitely need to get that done. But I think if my friend did it, I would be really weirded out.
I mean, like every time we text, I immediately go to there.
Yeah, like I would be super paranoid and like insecure, and like I would just, I don't know if I could handle it. It's like getting the physical done. Like, I don't know, it's just weird. Like, your mom did my physicals when I was a kid. I don't know, man. It's just weird. It's like people know the part of me that they shouldn't know. So I hope that goes well today. I hope you guys have a great day. Thank you so much for joining us today on this podcast. And we'll definitely send you guys all this stuff when we get done with it today. But I just want to thank you for what you do again. Thank you guys for your contribution to everything in our world and our nation. And because you guys play a big role, especially right now. Yep. Not only do you do this every day, but this is a special circumstance. So again, just thank you guys for all you do. We're thankful. And thanks for being on the What Are We Thinking podcast today.
Thanks for having us.
You guys have a great day. And both of you, love both of you guys so much. And I'll see you guys soon.
See you.
All right.
Thanks. Bye.
Bye. So,
Wow.
man.
Wow.
That was good. We should have done that like 2 months ago.
I know. Get ahead of it.
Yeah. Yeah, we didn't think that through.
This is one of those. I mean, I think I've heard there's millions of coronaviruses. Coronavirus is just kind of a generic term.
Right.
But there's just so much unknown about it, and there's so much that people make assumptions of.
Right.
And that was actually refreshing to hear that. I just bought my first mask last night. I ordered it. My wife has one. My daughter has one, and I have been hesitant and been like, I don't need it, man.
Right.
You know? But I think a privately owned business has the right to refuse service to me. Like, I can't get mad about that. Like, if a business owns their property, they own their area. I mean,
well,
so
it's the same with no shoes, no service.
Yeah, it's the exact same
thing.
Yeah.
It is the same thing.
And I'm not getting mad at people getting kicked out of Walmart for not wearing pants. Yeah, they need to get out. But yeah,
we may see less of them now.
That's great.
So we may see less of the people riding around in the chair with the thong on. I don't know. But
it's 2 weeks in a row. We've talked about dress codes.
Yes. Well, that's important. Like,
Yeah,
wear regular clothes. Like, well, not regular to you, regular to the rest of the population. Like, I know that's what you woke up in. That's great. But like, let's change. Let's be different before we leave.
Put your jorts and your Big Johnson T-shirt on.
Oh,
that's
Big
cool.
Johnson. That's so funny.
Yeah.
But it was a great learning experience for me. I think I learned a lot. I wish we'd have done that several weeks ago. But I think everybody was so burnt out on hearing about it. It's why we haven't done it yet.
But it was simple.
Yeah.
Like, that's just simple stuff to do.
It is simple.
And I understand it's a complete inconvenience for some. But that's that's something that we can do small to help our, the people around us.
Right.
Because we don't know their medical history, like he mentioned.
Yeah.
That's
we're not talking to doctors in New York City either. We're talking to doctors in our area. So like, that's very simple.
25 minutes down the road.
Yeah. Like, if you really care about the people around you and you don't know their medical history, like, if you're going to be standing right beside them, wear a mask. Like, pretty simple. If not, around your friends, don't do it. If you're out eating, obviously you can't do that. I tried that and the plane didn't work.
The feedback.
Don't cut a hole in your mask.
I don't think it works anymore. I want you to do that.
Yeah, I think it's pointless. But you guys have a great week. Thank you for joining the What Are We Thinking podcast. We will see you guys again next week for episode 12. We can't wait. Co-host Mark Anderson, thank you for joining us today.
Been a pleasure.
Covering in for Pastor Alex. We love you guys, and we will talk to you soon.